Together we achieve victory over heart failure.
Hello everyone, myself Dr. Shibsankar Sarkar, interventional cardiologist now practicing in Kolkata. Today we'll talk about 5 essential insights on heart failure. So slowly we are going into a silent epidemic that is in heart failure. In India, the majority of patients getting heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of elderly. So let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives, but it's not. The term heart failure can seem frightening, but it simply means the heart is struggling to pump blood as efficiently as it should. So secondly, why so many Indians are affected by heart failure? So genetics play a significant role in this scenario. So Indians are genetically more vulnerable to cardiovascular diseases and other risk factors of heart failure like hypertension, diabetes, obesity, and smoking habits, which worsens the epidemic. Moving on, what are the signs and symptoms of heart failure? So watch out for all the signs and symptoms that you may present as heart failure. So heart palpitations, shortness of breath, chest pain, loss of appetite, weakness, all, and many other. So how can we protect ourselves from this disease? Our hearts work incredibly hard to keep us alive. So there are 5 golden rules we can follow. Early detection of heart failure is very important in this scenario. So we can do regular blood tests by which we can easily detect the heart failure like NT-proBNP, etc. Dietary adjustment to maintain the heart health. So we should incorporate daily exercise into our routine. Practicing stress management techniques, quitting all addictions like alcohol, tobacco, smoking. Lastly, what comes next after a heart failure diagnosis? Thankfully, now medical sciences offers numerous treatment options. It is now possible to lead an enjoyable, meaningful, and productive life. Heart failure medications now improve the quality of life and longevity. There are so many devices in the treatment of heart failure now we can give to the patients, like devices like biventricular pacemaker, ICD, that is implantable cardioverter defibrillator, and many others like heart valve repair, replacement, and lastly, treatment like heart transplantation. The lifetime risk for heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. So together, by managing the risk factors, the symptoms, and properly diagnosis the heart failure, we can treat the patient and we can live a healthy and long life. Thank you so much.